let's talk about the concepts of community engagement and how that fits into the Project Lazarus model. Project Lazarus, by and large, is a public health bottom-up, public health top-down approach, which we designed the model to look something like a wheel. So in the center is a hub, and in that hub is the necessity of creating community awareness that there is a problem, and getting either new coalitions or groups of people activated to, once they've recognized there's a problem of prescription drug overdoses and other types of overdoses in their community, to recognize that this exists and that they as a community want to do something about it. And then there's a third area in this process, which is not what makes most people's hearts flutter, but it's the collection of data and program evaluation. So it's all intertwined. So as Chris Ringwald suggested, that it is critical that when one starts with a coalition, you need to be able to integrate from the outset the use of data, which is, I'm probably overstating it, but North Carolina has an embarrassment of riches for local communities to use when trying to increase their awareness and use the information at hand in the process of creating their strategic plans and going out into the community and finding partners that are willing to come and bring new approaches to bear. So what you have is data, evaluation tucked in to a group of people who are somehow energized and want to bring their combined expertise to the table so they can think of ways of preventing the misuse and abuse of prescription medications, primarily prescription medications that are for pain management, and most of these are opioids, and to be able to work together in a way that brings a fresh approach, which is usually prevention. Most people don't think about problem solving, particularly in the field of medicine, in terms of preventing it. They think in terms of, well, how do we get people to the emergency room, or what kind of new medications can we give them if they're overdosing, or what kind of new medications can we develop to address pain management. All of these things are good. But when you bring people together who have never thought about prevention, it has a tendency to open up new ideas and promote discussions. So within the community, you can bring your health department people, you can bring your school people, you can bring your law enforcement officers, you can bring people from juvenile justice and the court systems. You begin to bring various different components. You bring your religious community, everyone who would come in contact with someone who could potentially overdose from a prescription pain medication comes to the table, and they bring their collective wisdom and their collective experience and their new ideas to create something new, different, and exciting. And what happens with Project Lazarus, whether it's being developed in Wilkes County at the onset or in the different counties across the state, is you get new ideas that the community is willing to embrace and support because they're generated by the people in the community who decide that, yes, this is a problem and this is something that I am willing to take care of and to commit resources, time, personnel, money, and space to address this.